today. My name is Yvonne Boyer, and I am a Métis Nation of Ontario Métis. I have my ancestry is in Saskatchewan and the Red River of Manitoba. I've been here in Ontario for the past 25 years, so it's my home now. I want to thank the elders for their prayers, and I also want to thank Joyce's family for their words and for sharing today. So in Saskatchewan, we know that there's over 100 people who are sterilized without consent. And it was in the immediate aftermath of labor and or delivery. Some say they were coerced and intimidated, shamed, and threatened into getting their tubes tied, cut, or burnt. In 2017, Dr. Bartlett and I conducted an external review and found that Indigenous women were being sterilized in Saskatoon without their consent in the immediate aftermath of delivering their very last child. Since then, my office has become somewhat of a clearinghouse for calls from survivors and the experience of forced sterilization among Indigenous women we know spans the country, because we're getting calls from Nova Scotia, Quebec, Alberta, British Columbia, Manitoba, Ontario, and in the north, we know that there's a dismal historical record for sterilizing Inuit women without their consent. Adverse discriminatory treatment resulting in unwanted sterility has operated with impunity in Canada's public health care system, and it continues to do so with recently reported cases. Indigenous women are faced with indifferent dismissal when they claim mistreatment based on race, and a testament to this fact that it has taken until 2020 to convene leadership in what these survivors hope will be a meaningful and purposeful discussion with tangible outcomes and impacts on the issues of systemic racism in healthcare. There's documentary evidence dating back to the 1930s of Indian agents directing doctors to sterilize an Indigenous woman without her consent before it was too late, and stating that the woman may become pregnant if she's not immediately sterilized. The government cannot continue to turn a blind eye to this racism, and it must address it. Canada's public health care system is complex, we know that, and it has targeted Indigenous people, either willfully or through known disproportional impacts in its adverse institutional segregation, such as Indian hospitals, which we've heard about today, chronic underfunding and financial mismanagement, accountability, eugenics, and jurisdictional quagmires. To begin to remedy some of the issues that we're seeing today, we all know and understand that there's a lot of work that needs to happen. But only those who've really experienced the sharp cut of systemic racism, and in this case, the physical act of the slicing, cutting, or burning of the fallopian tubes, and resulting sterility, can inform what must be done alongside other Indigenous survivors of Canada's public health care system and their families. Without the lived experience, we have vacuous solutions void of pragmatism and practicality result. So my first recommendation is that any further plans, whether it be task forces, panels, or committees, must be led by the voices of the ones who know. The women who've been sterilized and the ones who've experienced racism in the healthcare system. These survivors decried these issues over 3 years ago, and even before that. They've since received federal and provincial sentiments of sadness and apologies, but really nothing has changed. Canada has failed to implement the United Nations Committee Against Torture's clear recommendations to prevent, punish, and provide reparation to the victims of forced sterilization. In Saskatchewan, yes, was sterilized without her consent in 2018. That was December. That was the days after the UN's recommendations. DDDS sterilization was foreseeable, it was preventable, and she had not been provided with the reparations to which she's entitled to this day. She stands with MRLP plaintiffs in a proposed class action in Saskatchewan that seeks prevention, accountability, and reparation. I wholeheartedly support this class action and others occurring around the country, unfortunately. Today, the survivors join their voices to the late Joyce's memory and her family, which systemic racism in healthcare has left in the wake of her tragic and preventable death. And they say Canada must approach the correction of systemic racism in healthcare with a seriousness that's equal to its fatal consequences. Canada can and should take action at the national level and is in a position to claw back federal health transfers based on its powers under the Canada Health Act. We've heard that today as well. For instance, Canada can order the removal of all race-based designations from health documents used to access healthcare services. The federal government can also mandate the provinces and territories to conduct their own independent investigations into the systemic racism in their own healthcare systems, like we're seeing in BC. My second recommendation is to strike a task force into the 5 pillars under the Canada Health Act, with a view to implementing provincial standards that address racism in healthcare. For many years, I have advocated for Canada to take heed of the constitutional status of Aboriginal and treaty rights that are articulated in Section 35 of the Constitution Act 1982. And it's important to take this approach in healthcare. Indigenous women were displaced from highly respected placement in their communities as family anchors to enduring multi-levels of trauma in Canadian society. Laws, legislation, policies, and regulations and religions were implemented that reflected a non-Indigenous version of reality. These underlying values have shaped the institutions and as a result have had a negative effect on the emotional, physical, spiritual, intellectual, and social health of Indigenous women. Along with the guardian and ward model, these gender-based realities underpin the health policies in our medical institutions and continue to have a harmful effect on the health of Indigenous women. Until the legal framework is recognized as part of the problem, there cannot be sustainable change. The health policies that are creating and supporting systemic and structural racism stem from the common practice of the government knowing what is best for Indigenous people. Through the legal premise, and outdated theories were implemented in early law and underpin many health policies that we see today. And my third recommendation is that we also look at how laws and legislation could be reviewed in order to remove the guardian and ward notions and ensure that Aboriginal and treaty rights are not being breached by the federal and provincial government. Many of the survivors of forced sterilization indicate they were unaware of their rights and that they didn't know that a doctor could not make them have that decision taken upon them to be sterilized without their consent. And this we know is fundamentally incorrect and blatantly contrary to the principles in Section 7 of the Canadian Charter of Rights and Freedoms. In this regard, my fourth recommendation is that Canada commit to and implement enforceable measures whereby any woman faced with the choice of sterilization is advised of her right to bodily autonomy guaranteed by Section 7 of the Charter. These measures, based on law, must communicate that her choice to undergo permanent sterilization must meet the legal tenets of proper and informed consent, which include, in brief, capacity, full disclosure, and specificity, consideration in an appropriate environment free from stress and free from coercion and other forms of duress, intimidation, and threat. Finally, we see on a daily basis the jurisdictions and the layered complexities of public health care in Canada that give rise to challenges in addressing systemic racism in its midst. We know that Indigenous lives matter and that they must be protected, and we know that Joyce will not be forgotten. Thank you. Miigwech, Marcy.